Hi everyone. In today's clip, I will talk a little bit about diabetes. Just a reminder that anything I post here is not meant to diagnose or cure anything, and it's for informational use only. For any health-related matters, please consult your healthcare provider. Diabetes is a condition where the body either cannot produce insulin or cannot properly use it. Insulin is a hormone that is produced by the pancreas. Insulin's role is to regulate the amount of sugar in the blood. Blood sugar has to be very carefully regulated to make sure that the body functions properly. Too much blood sugar can cause damage to the organs, blood vessels, and nerves. The body also needs insulin to use sugar properly for energy. There are three different major types of diabetes. There's type 2 diabetes, which is the most common diagnosis, followed by type 1 diabetes, and we also have gestational diabetes, which happens during pregnancy, and is usually temporary. In addition, prediabetes is another important diagnosis that indicates the elevated risk of developing diabetes. Type 1 diabetes is an autoimmune disease and is also known as insulin-dependent diabetes. People with this type of type 1 diabetes aren't able to produce their own insulin, so they can't regulate their blood sugar because their body is attacking the pancreas. This kind of diabetes generally develops in childhood or adolescence, but can also develop in adulthood. People with type 1 diabetes always need to inject insulin or use an insulin pump to ensure that their bodies have the right amount of insulin. People with type 2 diabetes can't properly use the insulin made by their bodies, or their bodies aren't able to produce enough insulin. Type 2 diabetes is the most commonly developed in adulthood, although it can also happen in childhood. This can sometimes be managed with healthy eating and regular exercises alone, but may also require medication or insulin therapy even. Gestational diabetes, as I mentioned, is a temporary form of diabetes that happens during pregnancy sometimes. Then we have pre-diabetes, which I talked about, which is a condition where blood sugar levels are higher than normal, but they are not yet high enough to be diagnosed as type 2. Having high blood sugar can cause diabetes-related complications like kidney disease, feet and leg problems, eye disease, such as retinopathy and blindness, heart attack, stroke, anxiety, nerve damage, amputation, erectile dysfunction, and so on. So diabetes-related complications can be very serious and even life-threatening. Properly managing blood sugar levels reduces the risk of developing these complications. Diabetes has various causes and risk factors, including an unhealthy pro-inflammatory diet, lack of physical activity, overweight or obesity, several micronutrient deficiencies, and mitochondrial dysfunction. And diabetes can be greatly reduced and even reversed using a low carbohydrate diet or intermittent fasting. Recent evidence shows that sufficient supply of vitamin D can protect from the most common forms of diabetes, type 2, type 1, and gestational. In trial with women who were suffering from insulin resistance, which is the preliminary stage of type 2 diabetes, and had a deficiency of vitamin D, daily supplementation of 4,000 international units for several months improved insulin resistance and insulin sensitivity more than the placebo. People with more weight or body fat, of course, needed more vitamin D to reach the healthy level. Vitamin D2 also helps prevent and treat several of the complications that may arise from diabetes. So cofactors of vitamin D have also an important role in the prevention of type 2 diabetes. Deficiencies of magnesium and vitamin K2 are some of the much needed supplementations that need to sort of come into play. So current medical practice relies on the HbA1c or glycated hemoglobin level as a measure of blood sugar over several months. The glycated hemoglobin is caused by high levels of sugar binding to hemoglobin inside the red blood cells. When it builds up, this means that the body's biochemicals and organs are being damaged by too much sugar. So now it's interesting to note how many of the diabetic patients are in the normal range of HbA1c, which is less than 6.5, but were still in agony over their feet. The problem was that seeing a normal value of HbA1c, the doctor would hesitate to change the treatment. Apparently, severe foot pain wasn't a symptom that needed attention. So in 2005, a UK researcher named Paul Thornley wrote a paper detailing how many diabetic symptoms are due to deficiency of thiamine or B1, vitamin B1. So elevated blood sugar levels promote a type of toxicity in the kidneys that causes B1 or thiamine to be excreted by the kidneys at a much higher rate, sort of like 16 to 25 times higher than normal, leading to an acute deficiency of thiamine. From other studies, it's also known that deficiencies of all B vitamins, as well as vitamin C, vitamin D, are common in diabetics. This can cause most of the symptoms of type 2 diabetes, which include polyneuropathy, nephropathy, which is kidney damage, retinopathy, which is eye damage, and eventually heart failure. In orthomolecular medicine, some of the most common nutrients in treating type 2 diabetes are a dietary supplement of thiamine, which is B1, but the more potent type of it is called benfotiamine. So they would give benfotiamine 250 milligram 4 times a day, vitamin B6 250 milligram a day, pyridoxal 5-phosphate or P5P 100 milligrams a day, magnesium, whether it is aspartate, citrate, malate, or chloride, and acetyl L-carnitine 1,000 milligrams a day, depending on the severity of the symptoms. So more recently, we learned that of the importance of taking vitamin C to reduce inflammation and prevent oxidation from high blood sugar levels. Supplementation with B vitamins and vitamins C, D, and E, and minerals like calcium and magnesium lessens the problems with insulin and blood sugar and the other serious symptoms that are to follow part of diabetes. In a metaphysical interpretation, diabetes shows as a symbol of lack of balance or control in life and inability to properly process and utilize life's sweetness, representing, for example, pleasure, joy, or positive experiences, often leading to a buildup of negativity or unprocessed emotions within the individual. It can also signify a disconnect sort of from one's inner power or life force, requiring a focus on self-care and mindful living to achieve balance. Basically, diabetes can symbolize an overconsumption of something in life, whether it be a material possession, negative thoughts, or emotional attachments, leading to a disruption in inner harmony. Also, having depression and diabetes is more common than you might think. people with diabetes are twice as likely to develop depression than people who don't have diabetes. Hope this has been helpful. Like and follow for more. Be the light.